Today we're going to briefly discuss the Achilles tendon injury and surgery. Now, the Achilles tendon is the largest and strongest tendon in the body. It connects the calf muscles, so the gastrocnemius and soleus, to the heel bone, the calcaneus, allowing us to perform activities like walking, running, jumping and pushing off the ground. Now, despite its strength, the Achilles tendon is prone to injuries, particularly in athletes or individuals who engage in repetitive or high intensity activities. Now, how does the Achilles tendon get injured? We have overuse, so Achilles tendinopathy. Now, this occurs due to chronic overuse when the tendon becomes inflamed, irritated, or begins to degenerate over time. It's often seen in runners or people who frequently engage in sports involving sprinting or jumping. Now, the symptoms of this are pain or stiffness or tenderness at the back of the ankle, especially during physical activity. The tendon may feel swollen or thickened in more chronic cases. Then we have the Achilles tendon rupture. Now, a rupture occurs when the Achilles tendon tears, either partially or fully. Now, this often happens during activities that involve sudden acceleration or pivoting, like basketball, football, or tennis. Now, how does it happen? It can be caused by a sudden increase in activity level, an awkward landing, or a powerful push-off while running or jumping. It's actually most common in middle-aged men who play recreational sports. Now, the symptoms is a sudden sharp pain in the back of the ankle, often described as feeling like a pop or a snap. After the rupture, individuals may struggle to walk or push off with the injured foot. Now, when and if they will operate on Achilles tendon. Now, treatment for an Achilles tendon injury depends on the severity of the injury, whether it's a tendinopathy or rupture, and the patient's activity levels and goals. So, non-surgical treatment for Achilles tendinopathy. In most cases of tendinopathy, surgery is not needed. Non-surgical treatment includes rest, so reducing or modifying activity to avoid stressing the tendon. So sports therapy, so stretching and strengthening exercises to improve flexibility and tendon function. At the middle stage of tendinopathy, so if we follow the Cook's continuum, so at the dysfunctional stage, we do some at the later dysfunctional stage, we'll do some eccentric exercises, and these are exercises that strengthen the Achilles by slowly lengthening the tendon under load. We don't do this on a reactive tendon or an early dysfunctional tendon. We could use orthotics or heel lifts to reduce tension on the Achilles tendon during movement. And we can just manage the pain and swelling by anti-inflammatory medication and maybe a little bit of ice. For a partial Achilles rupture, so in some cases a partial tear can be treated non-surgically, especially in less active individuals. So this usually involves immobilization, so wearing a cast or boot to allow the tendon to heal. And after immobilization, sports therapy is really important to restore strength and flexibility. Now, if we look at surgical treatment for an Achilles tendon rupture, now surgery is often recommended for a complete rupture, especially for athletes or highly active individuals who want to regain full strength and function. Now, during surgery, the torn ends of the tendon are stitched back together, and this procedure helps to restore the strength and function of the tendon more reliably, particularly in those who need a strong push-off for their sports or activities. Now, surgeons prefer to operate within the first few weeks after the rupture for the best results. Delayed surgery can make the repair more difficult due to tissue degeneration or scarring. Now, considerations for surgery. They use activity level. So surgery is typically recommended for younger or more active individuals who want to return to high-level sport or physical activity. They also use age and health. So non-surgical treatment is more commonly considered for older or less active individuals, where avoiding surgery's risk may be preferable. And just remember about the risks of surgery. So surgery comes with risks such as infection, nerve damage, or a longer recovery period. However, it's typically offered better outcomes for active individuals compared to non-surgical treatments. So in summary, the Achilles tendon is prone to injuries such as tendinopathy from overuse and ruptures from sudden force. Now, non-surgical treatments such as rest and sports therapy are often enough for tendinopathy and some partial tears. However, surgery is typically required for a complete rupture, especially for athletes or active individuals who want to return to high-intensity sports. Whether surgery is needed depends on the severity of the injury, the patient's activity level, and their goals for recovery.